Welcome, everybody, to the Valley Wellness Podcast. We are missing Dr. Haskett and Dr. Clower today. I'm stepping in to host. Just to reintroduce myself, my name is Jennifer Krebs. I'm a certified nurse midwife and advanced practice nurse over at Valley Hormone Wellness. I'm really excited today to have Taylor Lewis with us. I'm going to give Taylor an opportunity to introduce herself here really quick. She's had enough time to practice with us and kind of get her feet wet and get adjusted in the clinic, and has so much to offer and to share today. So Taylor, give us a little background on your education and your practice.
Okay. Yeah. Thank you. So I'm really excited to be here. I love being a part of Valley Hormone Wellness. It's been a really, really fun last few months. So I'm Taylor Lewis. I am a board certified family nurse practitioner, but I've been in the healthcare realm for a little over 20 years. I was a registered nurse, started out in the ER, which was really fun and exciting. But then I had a baby myself and realized how amazing working with women can be. And so most of my RN experience was in women's health. I did labor and delivery, postpartum, a little bit of nursery. I taught prenatal classes for years and years. I also did lactation for several years, and then got a wild hair and decided to go back to school and get my family nurse practitioner license. And it's been incredible and life-changing. And it was a super hard road to get there, but I love doing what I do. So I worked in family practice at first, and I worked at an integrative health clinic where I gained a lot of experience in wellness and hormone therapy, and really just decided that's where I wanted to be long-term. So thankfully I was recruited by Valley Wellness, and I've always said I just feel home in the space of women's care. So
Yep. Taylor's got an incredible knowledge base, an incredible base of experience, just an incredible bedside manner and way of communicating with patients. And it's just exciting to have her around.
Oh, thanks. I'm excited. I'm excited to be here.
So today, the topic we've been asked to address is sleep. I have a whole list of commonly asked questions by our patients, the most common things we address, the most common problems that we find and run into clinically, just things that we feel are really important, an important knowledge base for women specifically to have. So question number 1, why is sleep so important to your health?
So I'll start.
Yes.
When it comes down to it, we need 3 vital things to survive. The first is water, the second is food, and the third is actually sleep. We cannot survive without sleep. And yet I feel like as a society, we really don't prioritize sleep. You know, we often say things like sleep when we die, or, no rest for the weary. But
especially those of us in medicine who have worked night shift at the hospitals.
Yes,
the number of times
13
you hear
years of
things
night
like,
shifts. Yeah, for sure. So it really needs to be prioritized. There's some really, really incredible things that happen when we sleep. And we need to make it an important part of our healthcare routine.
Yeah. One of the things that I always like to address with my patients when they come in for any reason, whether it's general health, whether it's weight loss, whether it's anxiety and depression, it doesn't matter what the problem is. I like to address the 5 pillars of health: nutrition, exercise, sleep, stress management, and relationships. And like you said, sleep is, it's essential to living. And there are so many things that happen with sleep, and we don't realize the kind of downstream effect that poor sleep has on us. It has such a profound impact on the way that we produce neurotransmitters that improve our overall sense of well-being and mood, those hormones that increase satiety and reduce appetite.
Absolutely.
Our insulin sensitivity, and we'll go into detail on a lot of these things. Anytime something's not going well for us or our treatments aren't working, so many times and so commonly in my practice, I can find that it is somehow tied to poor sleep habits, poor sleep quality, poor sleep architecture, and addressing that problem can address the root cause of a lot of other problems that we have.
Yeah, I mean, and we do so many things throughout our day to help maintain health, but what we don't realize is that our body actually goes to work when we're sleeping. I love the movie Inside Out, and I talk about it a lot with my patients when it comes to sleep, because when we're sleeping is when, the little workers in our brain go, okay, let's process these memories. Let's remove neurotoxins. Let's, balance hormones. Let's restore energy. Let's improve our metabolism, work on our insulin sensitivity. I mean, that it really is when our body recharges and really puts the work in that we do throughout the day.
We come from a culture that emphasizes action, right? My patients will always come to me and they're so proud of everything that they do. I get up this early and I work out, and I work out 5 days a week and 6 days a week, and I have kids in soccer, and I work full time, and I do all this. And I think, yes, but when do you rest? All the things that we do are really important, but the rest that we give ourselves is just as important as the action that we participate in.
Yeah, for sure. I mean, we spend a third of our life asleep.
Yeah,
right?
We evolved that way for a reason.
Right.
It serves a very real purpose.
For sure.
All right. How many hours of sleep are recommended? And does that change with age and with time?
Yeah, for sure. I mean, we think about, if we think about the younger population, infants need 18 to 20 hours of sleep a day, right? And our teens actually need a lot more sleep than they're getting. That's a whole other podcast, 8 to 10 hours a day. But for adults, between 7 to 9 hours is the general recommendation for sleep. And some might need a little bit more than that, but definitely not less. In fact, interesting study came out showing that every hour under 6 that adults get actually increases their risk of mortality long term, up to 8 to 10%. So.
Yeah, I remember hearing about studies done on college students where they induce sleep deprivation as well for, I think they didn't let them get more than 4 hours of sleep a night for 2 weeks, and then measured the impact that had on their insulin sensitivity, on their metabolic health. And it's amazing what any less than that can do to your endogenous hormone function.
Right. And your circadian rhythms and your heart health too. I mean, there was a study that was done, and I remember reading this when I was a night shift nurse, so working, sometimes 8 nights in a row, and on long-term risks with cardiovascular disease was comparable 20 years, a 20-year study done of people that smoked on a consistent basis and and night shift workers who were not getting, whose circadian rhythms were disrupted, who are not getting adequate sleep, and life expectancy was actually the same. So pretty significant, of course, we know the risks of that smoking has on our cardiovascular health, but again, we don't really think that sleep and sleep deprivation is that vital to our health, and it really is.
Yeah, it is. And the studies in every specialty within medicine prove this over and over again. It doesn't matter if you're talking about cardiology or neurology or endocrine health or metabolic health
or mental health.
Yeah, the impacts of sleep deprivation are widespread throughout every specialty in medicine, which brings us to the next question, actually. So what kinds of things happen if we don't get enough sleep?
Yeah, so I think we've highlighted a lot, several of them already, but initially, the lack of sleep really does affect our hormones. So namely our catecholamine and our cortisol hormones, and those are our stress hormones, right? So those are the hormones, we don't get enough sleep, we're going to wake up feeling agitated, irritated, moodiness. We're not as productive throughout our day. So that's
function.
Right. Yeah, absolutely. You mentioned decreased insulin sensitivity, and that's huge. So when we don't get enough sleep, insulin sensitivity, so our body, we eat glucose, our body sends out insulin. If our insulin doesn't respond to that glucose gets stored as fat. So it really impairs that process. But not only that, it has a profound effect on our ghrelin and our leptin. So ghrelin is what causes us to be more snacky, have more cravings, and then leptin it's involved in our appetite, and then leptin is what tells us that we're full. So it's kind of this big colossal, effect of I'm not as insulin sensitive, but then also I'm more snacky and I don't know when to stop. And, that leads to a whole other slew of problems like obesity and type 2 diabetes and
and inflammation
Mhm.
and, these unstable glucose levels and the increased circulation of glucose in our blood and the glycation effect on the vascular system, which affects our cardiovascular health, which affects our long-term risks for cognition and things like dementia. The cascade of hormonal effects is
Widespread.
alarming.
Yeah.
Yeah.
For sure. I mean, it also affects our natural melatonin production as well. So melatonin is our sleep hormone. It helps us feel tired. It helps us go to bed. So it can certainly be a perpetuating problem if it affects our melatonin. And then again, our circadian rhythms, which affects our heart health.
Yeah. So now that we've terrified everybody
Into sleeping.
now that we've increased their anxiety about sleep, so it makes it harder to fall asleep and stay asleep. Let's talk about maybe give a little bit of hope. One of the common things I hear is I was sleeping fine until I turned 40 or 45 or until I turned 50, and then everything got disrupted. Why does that happen? And let's talk about things that we can do.
Okay. Yeah, well, I think it's important to recognize that sleep is something that should happen. It really is something that should happen naturally. We really shouldn't have to think about sleeping, just like we shouldn't have to think about breathing. So when sleep isn't happening, it is a signal, it is a message that something is not right. Something's, whether that's physiological, whether that's our habits. But when sleeping isn't occurring, I think it's a cause to pause and evaluate what's going on. In relation to age-related changes, for sure. I mean, I get this all the time. I slept fine, 40, 45, 50s. I can no longer sleep, whether it's falling asleep or staying asleep. And there's a lot of processes that are involved in that. First of all, hormones. I mean, we're Valley Hormone Wellness, so of course we're going to talk about hormones. Hormones is a big factor in sleep related changes. Without getting into the whole hormone cycle, but I see this even in my younger population that are cycling. The few days before their period is when sleep disruption is usually the highest, and that's because hormone levels really fall off a cliff in order to stimulate the period. So low levels of progesterone, low levels of estrogen can certainly cause sleep disruption.
When you talk about being Valley Hormone and Wellness, so for this particular age population that's experiencing erratic fluctuations or decline in these hormones, can you talk about the importance of hormone replacement therapy?
Yeah,
and why
absolutely.
We do that and when?
Absolutely, for sure. So let's talk about each of the hormones individually first. So let's talk about progesterone. Progesterone has been commonly believed to be just a pregnancy hormone, just a hormone that's useful for our uterus and useful to, either maintain pregnancy or to fall off and cause a period to happen. But we actually have hormone receptors throughout our entire body. So we have hormone receptors in our brain, and that is really where progesterone can come into play and be helpful for sleep. So progesterone can help regulate those neurotransmitters in our brain and be so helpful to in falling asleep and staying asleep. Progesterone, unfortunately, is the first hormone to go in perimenopause and menopause. So that is why, women in their 40s are saying, why can I no longer sleep? And actually sleep in the progression of hormone decline, sleep and sleep disturbances is typically the first common sign and signal of hormone, fluctuation or dysregulation. Because it happens so soon. Progesterone is the first hormone that we lose because as our hormones start to decline and our ovarian reserve starts to decline, we start to have these inovulatory periods, and progesterone just really doesn't know when to come into play anymore. I often say it doesn't know when to clock into work, right? So it just we don't get this rise and fall of progesterone like we used to, and it really, really affects how we sleep, how we fall asleep, how we stay asleep. So that's progesterone's job, in my opinion. And then estrogen really comes into play with the restorative sleep, with the deep sleep that we get. Not only that, but hot flashes and night sweats. Let's talk about it. They're the neon lights of menopausal symptoms. And it's because estrogen plays a really big role in our temperature regulation. So, I mean, that's why with declining levels of estrogen, we get hot flashes and night sweats, because estrogen can no longer help regulate our temperature, and our temperature naturally drops at night, which is when women wake up sweating to death. So there's that aspect of sleep disturbance, but then also estrogen really promotes that really deep, restful sleep.
Yeah. And we do have an entire episode on the research behind hormone replacement therapy and the safety and the efficacy of all that.
For sure.
Because I know when we talk about these things, there's a certain segment of the population that starts thinking, yes, but hormones, aren't those dangerous? Aren't those? And the answer is no. And there's an entire episode on that I encourage everybody to go and listen to.
Yeah, we could talk way too long about that.
Yes.
So, yeah, for sure.
Only so much time right now.
Mm-hmm.
One of the things that I think is really important to address is commonly prescribed sleep medications.
Absolutely.
They are very widely prescribed. There are a lot of people that feel like it is necessary for them to take these medications in order to sleep. Let's talk a little bit about the common medications used, when it's appropriate to use them, for how long, and benefits and risks associated with those. And maybe we can start with the benzodiazepines.
Right. So first of all, benzodiazepines are one of the most highly addictive medications out there. Not only that, but second to alcohol, they are the hardest to detox from and to come off of. So relying on a benzodiazepine to put you to sleep is really, in my opinion, not good medicine. Also, I think it's important. It's important to just know how highly addictive these medications are. They come with unwanted side effects. They really disrupt our natural chemistry in the brain. Not only that, but we start to depend. There's dependency, and we teach our body that we need something to fall asleep. And that in and of itself disrupts our sleep hygiene and our sleep quality. And
yeah, it's important to remember that we can train our body not to function the way that it's supposed to. When you take over that process, your body loses practice in doing that, and it's different than using hormones for peri and postmenopausal women, right? Because what naturally happens is that our hormones decline and they just don't function, or they're not synthesized anymore, and there is nothing that we can do to bring those back. When it comes to circadian rhythm patterns and the hormones and receptors that are involved in falling asleep and staying asleep, these are things that continue throughout our lifespan, and it's really important to keep those cycles and those neurotransmitters and hormones functioning appropriately. And when we disrupt that process, we train our body not to do it. So we develop a dependency chemically on some of these pharmaceuticals, but also like a hormone and neurotransmitter dependency, in that way as well.
Well, and also so many of these medications are sedative medications. So benzodiazepines specifically and especially, they're sedative medications, and sedation. I think it's really important to understand that sedation and sleep have very big differences. There's different things that happen in our brain when we're in a natural deep sleep pattern versus when we're sedated.
Yeah. It's one thing to be unconscious. It's another thing to let our body cycle, or our brain cycle, through the patterns of deep sleep and REM sleep.
Right.
And each of those stages of sleep have a very real impact on the restorative effects on our brain and our body and our tissues. So the other common medications are zolpidem or Ambien. So these are non-benzodiazepines. Ambien and Lunesta. Maybe there's a number of others as well.
Trazodone, I feel like, is another common one. And trazodone's been around for many, 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 many years.
Has a different mechanism of action, a serotonin modulator.
Yeah.
What else? Sonata. These are all really common. Let's talk about the ways that those affect your brain, and might have short and long-term effects. How often when you prescribe these, or you're talking to women who are on these medications, do you recommend that they take them, and for what duration of time?
It's very rare that I will recommend these medications to be taken on a long-term basis. And typically when I do, I go for more of like a trazodone, and I recommend that, it's taken on a short-term basis. There's a difference between sleep disruption and insomnia, based on how many days of inability to sleep. If you have true insomnia, we're talking about more than 30 days of not being able to sleep adequately, fall asleep, stay asleep. And again, I really want to look at the root causes of why you're not falling asleep before I slap sleep medication on the problem. Because I think when we dig deep and we can, look at hormone imbalances, blood sugar regulation is another big one. Look at your lifestyle. Sleep hygiene. I think if we can get to the root cause, these medications, in my opinion, and most of my patients, really don't become necessary.
And we live in a medical culture that has a habit of throwing medications and prescriptions
Absolutely.
at things rather than spending the time that we need to on lifestyle.
Absolutely. And you bring up a good point, is time, right?
Mm-hmm.
I mean, thankfully, where we're currently working, we have time to really talk about what patients are doing when they first wake up in the morning to when they first go to bed,
mm-hmm.
and what their lifestyle is like. And unfortunately, in a insurance-based, model, in a 15-minute quick appointment, when you bring up, gosh, I can't sleep well, we just don't have the time. We just don't have the time to really dig.
We got to listen to heart and lungs.
Yeah,
we got to do a pap smear. We got to do a breast
absolutely.
exam.
Yeah.
We got to do all these things in that short period of time. And talking about sleep hygiene is infinitely important, but there's just not time to do it in common practice. So it becomes a really big issue. And I want to be appropriately sensitive to people who really struggle with sleep, because it is a truly desperate state to feel like you can't sleep, you can't fall asleep, you can't stay asleep, and it's been going on for so long, and you're so tired, and your family needs you, and you've got to get to work, and you've got to function. And it is such a desperate feeling, and people need solutions.
Absolutely.
And I want to be really sensitive to that, because there are times when I think, you need a few things in your toolkit
for sure
for when that sleep deprivation accumulates. And you need something. But the studies on these medications and using them on a regular basis
and
for
long-term
periods of time, like more than 2 to 4 weeks, can have such an intense long-term effect on the way your GABA receptors function, and your long-term risks for cognitive dysfunction, and actually have been associated with higher risks of dementia
and depression
and anxiety.
Mm-hmm.
Yeah. So other common medications that I find people are on that have, and maybe not equal, but also profound long-term effect, are the antihistamines, Benadryl and hydroxyzine. And I think really commonly my patient population feels like, well, these aren't controlled substances, so I can take these every day, and it's totally fine. These are Benadryls available over the counter, so this should be totally safe to use. How do you address that clinically?
Again, I think everything in moderation, and I really do empathize with your, what you said about that desperation, just needing to sleep. I have to function at work. My family needs me, et cetera, et cetera. And I feel like, these sedatives, that are over the counter, can be utilized, but on a short-term basis, no more than 1 to 2 weeks. And if you're needing them on a nightly basis, that's when a really good evaluation needs to be done on why you're not sleeping. Instead of, I feel like you can still develop a dependency. Kind of on the same topic, I want to talk about melatonin a little bit too. And melatonin is, it's in gummies that we can give to our children.
Yeah, it's one of the few hormones that's available over the counter,
right?
In the United States.
Yeah, and it's in a lot of proprietary blends, and people take it on a regular basis to sleep. And melatonin is a natural occurring hormone that we make ourselves. And when we give it on a regular, every single night basis, we are telling our body, oh, take it easy. You don't need to make melatonin because look, we got you, right? And it really should be used on a short-term basis. I'll be the first one to tell you, I was a night shift nurse for over 15 years, and I would work 8 night shifts in a row sometimes, and I would take a Tylenol PM or I would take a melatonin to try to flip my schedule back. And in my opinion, that's really the appropriate time that you should be using these is, jet lag or, when you're in if you're not going to sleep well in a hotel or when you're camping or, anytime you have like a disruption in your circadian rhythm. Yeah, for sure. Yeah. But on a short-term basis, they really need to be utilized for short-term use only and not given to children every single night.
Yeah. And, having multiple resources to use rather than having one medication that you rely on a regular basis.
For sure.
So the other one I really wanted to address is something that I'm seeing really just in the last maybe 3 to 5 years, really commonly, is the use of Seroquel. Quetiapine, especially in my peri and postmenopausal patients. I would say almost half of the women that I see now that struggle with insomnia and sleep disturbances are being prescribed by outside providers Seroquel. And it is, they're always really surprised when I tell them that it is an atypical antipsychotic. And this is a class of medications that is it's an off-label use, which is fine, right? We use medications off-label all the time. But it has a very real impact on your metabolism. And very commonly when I see women for weight loss, and they are struggling to lose weight and nothing that we're doing is working, I do find that they're on some of these medications that are known metabolic disruptors.
Right.
Do you have any experience with this?
Just that I've seen the same thing. Yeah, that I've seen patients on up to 200 milligrams of Seroquel, specifically for sleep, and it is an antipsychotic medication, which means it is working on those GABA receptors and those neurotransmitters and altering them. And I just feel like yes, we commonly use medications that were once created for a certain purpose. We use them for, like you said, an off-label, but in my opinion, Seroquel shouldn't be used on a regular routine basis for sleep deprivation, for sleeplessness. I think there's a lot of other better alternatives.
And I think one of the more concerning things that I've seen just in reports this year from multiple specialties, but specifically neurology, is the link to these, Seroquel has an impact on dopamine and serotonin and, an anticholinergic, a histamine effect. And the impact that chronic use of these medications, specifically in women over 50, have on their risks for dementia. And that depending on the study, that risk increases somewhere between 20 and 50%.
Right. And your risk for dementia already, because you're a woman, because you are over 50, your risks are already up there. We really shouldn't be contributing anything else to that risk. So,
alternatives for sleep. Let's talk about that. We've talked about the dangers of a lot of prescription medications, the dangers of sleep deprivation. What are some alternatives that you use in your patients that really struggle with sleep, maybe that are already on hormone replacement therapy? What kinds of things do you suggest?
Yeah. So first and foremost, and this is a supplement I will take for the rest of my life, but I always recommend magnesium for patients. 80% of Americans are deficient in our magnesium. And there's a myriad of reasons. One of the main ones is our farming and agriculture processes that we use now. Our soil is just very, very depleted of magnesium that we used to get, and we just don't get that in the foods that we eat any longer. Not only that, but other things like caffeine and alcohol use, refined sugar, processed foods, all of those things deplete our magnesium stores. So studies have been done that people that are significantly deficient in magnesium do struggle with sleep and with falling, staying, and with the overall quality of their sleep. So that's generally the first thing that I recommend is magnesium.
And what kind of magnesium?
Perfect question. I'm going to get asked that all the time because, there are 8 to 10 different magnesiums. And so when I say magnesium, that's the first thing I get is, but what kind of magnesium? I go to the, health food store and I see all the magnesiums.
Malate.
Right. Citrate, 3 and 8. Yeah. Taurate, there's so many. So for sleep specifically, we're looking at magnesium glycinate. It's also chelate is another format or name for it. But that one specifically works on the GABA receptors in the brain. It also helps with muscle relaxation. People will say, well, gosh, can I take it in the morning, or can I take it during the day? You can. It's certainly not going to make you groggy or sedative or tired, but it just helps better. It promotes better sleep initiation, but also duration. Yeah. So that's definitely one of my favorites. And then the next one is L-theanine. L-theanine is one of my favorite supplements, and it is an amino acid. It's gained a lot of popularity in the sleep space because it helps with sleep without a sedative effect at all. So again, it's an amino acid that works on the GABA receptors of our brain. It passes the blood-brain barrier very, very quickly, so it works fast, and it really helps just calm down those catecholamines that can, those excitatory neurotransmitters in the brain. But and also, again, working on the GABA receptors, it helps calm the brain as well. So when I talk to patients about L-theanine, I'll say, it just really takes down that brain noise. That overexcitement that often is associated with sleep, just feeling like, man, I'm super tired. And then the minute I try and go to sleep, I just can't shut my brain off. I just start solving the world's problems. And that's where L-theanine can have a really big impact.
Awesome. I know that there are also studies on valerian root, chamomile.
Absolutely.
Ashwagandha. Yeah. A lot of the adaptogenics.
Mm-hmm.
So there are a number of herbal preparations that are safe to use on a regular basis. And in fact, some of them we recommend on, like you said, magnesium glycinate. I know both of us recommend that to all of our patients every night.
Mm-hmm.
And that's something that can be done safely, regularly, and is actually part of probably good sleep habits.
Right. And just good general health too, right? So we're not creating a dependency on these medications, but they're just more sleep promoting.
Mm-hmm.
Yeah. And one thing, again, about L-theanine that I love is it can be taken at the 2, 3, 4 a.m. hour because it's non-sedative. So it just helps, that racing mind. We all wake up in our sleep. I mean, often people will say, gosh, I wake up in the middle of the night. Well, we all do. If you're sleep training an infant, they wake up, they just require you to help them put them back to sleep. So as adults, we all wake up in the middle of the night, whether that's going to the bathroom or just changing positions, but it's about being able to fall back asleep easily that then becomes the common problem.
Yeah. I like pointing out that L-theanine is the component of green tea that occurs with the caffeine, that, the caffeine gives you energy. And, a lot of times in other sources of beverages, the caffeine gives you that kind of jittery energy. But L-theanine is the part of green tea that provides that calming effect. So you get that non-jittery energy when you drink that.
Right. Yeah. I mean, L-theanine a lot of times is in other supplements to help with focus, even because it does just kind of block out that other, like in a ADHD type situation, it can kind of help block the those other neurotransmitters that might, cause
jumbled thought patterns.
Right. Yeah. Thank you.
What about behavioral habits?
Right. This is probably my favorite question because, I really feel like we need to be thinking about sleep from the moment we wake up in the morning. And, we are a society of go, 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 right? We wake up, maybe we work out, or a lot of times the first thing we do is grab our phone. We grab our phone, we look at what messages have come in through the night, we look at our emails, we look at
social media. Constant assault of information on our brains.
Right. And we're looking at an artificial light, right? And then what do? We drink caffeine. So we're looking at artificial light, we're drinking caffeine, and first thing in the morning, that's when our cortisol levels are actually the highest. So if we wake up in the morning and we bombard ourselves with all this information, and then we drink a good amount of caffeine, we've just raised our cortisol levels even further. And that cortisol, over time, if this is our daily habitual habit, that cortisol gets accustomed to being high, and cortisol disruption is probably the number one reason, in my opinion, for sleep disruption. So if we can even just delay caffeine by an hour, we get dehydrated through the night. It's the only time we go 8 to 9 hours without hopefully 8 to 9 hours without drinking, right? So, and then we sweat and we breathe, off CO2. And so we wake up naturally dehydrated, and then we drink caffeine, our cortisol levels soar, we're dehydrated throughout the day, which makes us have to catch up. So if we can delay caffeine by an hour or two, that can significantly help those cortisol levels.
The interesting thing about that too is that delaying caffeine intake not only improves those cortisol spikes, but it actually improves the rate at which you crash from the caffeine later in the day because of the competition for adenosine receptors in the brain.
Yeah, absolutely, because that caffeine stops that adenosine, which is our sleep. It's what helps keep us asleep. So we wake up, we're groggy because we still got that adenosine on board. We drink a bunch of caffeine that blocks the adenosine. 2 to 3 hours later, that caffeine wears off. And then what's there? Well, it's that adenosine again.
It just rushes those receptors. So it's really common to get that afternoon crash from your caffeine because you drink it first thing in the morning.
Right.
I'm like the biggest hypocrite alive when it comes to this, but it is true.
We're all working on certain things. So yeah, don't get me wrong. I enjoy caffeine as well, but yeah. So, and then, call me hippie, but morning sunlight is really, really important.
Well, that's neuroscience at this point.
Right. Thank you.
Yeah.
So getting morning sunlight first thing in the morning is really vital to our cortisol production and our cortisol metabolism and rhythms. So much better than that artificial light. So again, like we wake up in the morning, we are looking at our phones, we get in our cars, we go to work, we're under artificial light, we look at screens all day, we get back in our car, we drive home, we watch TV, we go to bed. And it's this consistent cycle of not getting that natural sunlight that actually raises our serotonin levels, which gets converted to melatonin at night.
Mm-hmm. And then the constant exposure to artificial light way after the sun goes down.
Right.
So there are filters that you can set on your phone so that you can block the blue light. There's blue light glasses. You can.
We both wear ours consistently.
Yes, we're really good at that. There are some things we're really good at. But blue light glasses for looking at screens. There are filters that you can set on your phone. So when the sun goes down, there's a filter on your phone. Leaving your phone the hour or two before bed,
in a different room, for sure.
Not drinking that caffeine in the afternoon.
Absolutely. Movement. I mean, again, talking about serotonin, anything that we can do to help raise our serotonin levels in the morning. So working out, morning sunlight, serotonin gets converted to that melatonin at night that tells us that we're sleepy, groggy, it's time for bed. So movement is another really important aspect of sleep hygiene as well.
Yeah, and I would say that we focus really, really well in the health space on nutrition and exercise, but we are very deficient in the way that we talk about really protecting our sleep quality and the behaviors that we can participate in order to protect that.
Absolutely.
All right, really quick, sleep apnea. I feel like specifically in women's health, sleep apnea is something that is underdiagnosed, it's underaddressed, and we're, similar to the way that we've recognized in medicine that we don't address women's cardiac issues, like women present differently with heart attack symptoms. I think that we fail to recognize the ways that women present differently with sleep apnea.
Right. Yeah. So, fatigue, when fatigue's addressed, we kind of start thinking, okay, is it thyroid? Is it iron? Sleep apnea needs to be part of that too. Obviously, if we're not sleeping well, or if we're waking up consistently in the night, sleep apnea needs to be something that's assessed for. Headaches in the morning. So if you're waking up with headaches, that is kind of a telltale sign, specifically in women, that there could be a sleep apnea.
Some oxygen deprivation throughout the night.
Absolutely, yeah. I mean,
whereas
generally,
with men, there's really loud snoring,
right.
which can happen with women, but to a lesser extent, and it's not really obvious.
Yeah, absolutely.
Yeah, and it's definitely something that needs to be addressed and can be corrected. And there are ways to
assessed for,
to medically assess for it,
and at home too. I know a lot of people think I'm not going to a sleep center. I don't want to, I won't sleep well. Like there's at-home tests now,
devices that you can wear. Right. I think they even have a ring now that you can wear that assesses for sleep apnea that aren't totally, as opposed to evasive, the monitors, the big monitors that are really uncomfortable and intrusive. Okay, favorite apps or websites?
Headspace is a really great app. So it is, really quick 5 to 8 minute meditations that you can go through. I think one thing that we need to address really quickly in sleep hygiene is that our bed is for sleep, and maybe activities with our bed partner, but our bed is for sleep, and we need to prioritize that when we go to bed, it's for sleep only, and that sleep hygiene and what we do before bed is to prepare us and to get us tired to then get into bed. So these things like meditation and hot baths and all of that is to prepare us to then be tired and go to sleep. So, apps that help with sleep, like I said, Headspace is a great one that does, quick little 5, 10, 15-minute meditation. There's also one called Calm that, can kind of walk you through meditations and just get your mind prepared for sleep. Do you have any that you commonly recommend?
I like those. I'm a really big advocate for meditative practices,
right?
And the neuroscience behind meditation and what that does for us on a lot of different levels, but helps us prepare for sleep, and the participating in kind of a ritual practice that trains your brain. Like, okay, now we're doing this meditation. Now we're brushing our teeth. Now we're, your brain starts to prepare itself for sleep. And a lot of those apps, the ones that you mentioned are really good at helping you do that. I also like sleepfoundation.org, which has really good tips for sleep and sleep hygiene and resources as well.
I do have a question. What do you generally recommend to your patients when waking up in the middle of the night and falling back to sleep?
Ooh, well, usually I address the foundations of sleep hygiene behavior. I will, it depends a lot on lifestyle and nutrition. I will really commonly, when that's a problem, actually have women wear continuous glucose monitors.
Right.
Because I do find that a lot of nocturnal awakening has to do with blood sugar imbalances.
Right. And we didn't talk specifically about that, but alcohol is another thing that we need to avoid a few hours before bed. And that's a tricky one because people think, well, no, I drink 1 to 2 glasses of wine before bed and it makes me fall asleep. But what actually happens is we get a rebound effect. And, yes, alcohol is sedative again, but that alcohol metabolizes within a few hours and we get this rebound effect to where we get just really disorganized and disrupted sleep throughout the night. Women usually heart palpitations, increased dehydration, that type of thing that causes us to be more fatigued, more tired in the morning.
A really common sleep disruptor, yes.
Right.
So alcohol, blood sugar imbalances.
Eating too close to bedtime, for sure.
That's a really good one.
Yeah. Our blood supply goes to our gut to digest, and we get those blood sugar spikes in the middle of the night.
Especially those high carb, high sugar meals.
Ice cream, cereal before bed.
Those desserts, right? Yeah.
Yeah.
It's really common for my patients to tell me that they crave sweets in the evenings.
Yeah, for sure.
And what that can do to blood sugar spikes and troughs throughout the night and how that can disrupt sleep architecture.
Right.
Again, it's not just about being unconscious for the entire period of the night. It's about the architecture of that sleep and protecting the way that we cycle through it.
Right.
And those are really common. Also, getting up to urinate in the middle of the night. So I frequently recommend that women stop drinking fluids like 2 hours before bed.
Also, another interesting thought about waking in the middle of the night. Often we think like, oh, if I wake in the middle of the night and I can't sleep, like we just stay in bed and we just spend these hours and hours tossing and turning, trying to get back to sleep. When there's some interesting research about actually getting out of bed, and we think, gosh, that just seems counterintuitive, right? But again, if we can just associate our bed with good restful sleep, so if we can get out of bed and do something very mindless, so a puzzle or knitting or listen to a podcast
for a short period of time.
Right. For a short period of time until we're tired and then returning to bed. That usually has more success with returning to sleep than spending those hours tossing and turning, looking at the clock, feeling anxious about the lack of sleep we're going to get or and what we have to do the next day and so forth. And take your L-theanine.
Yes, and all the other things.
And all the other things, yes.
Yeah. Important things. All important things to consider.
For sure.
Also, we always emphasize that it's when you're struggling with the basics, and nothing you seem to be doing is helping. It's important to come talk to a healthcare provider to undergo a thorough evaluation. You might need to be tested for sleep apnea. You might need some laboratory evaluation to look at your endocrine health, to look at your hormone health, to look at
low
nutritional
iron
deficiencies.
is associated with sleep irritability
and restless
legs. Yeah, that can wake you up in the middle of the night. So, I mean, there are definitely some reasons to be evaluated and see how you're
protect those foundations.
Yeah, for sure.
So I want to just kind of wrap things up by reminding everybody listening that this podcast is for general information purposes, that this in no way establishes a provider-patient relationship, and that this is not medical advice for each individual. So if you are struggling in any way or need additional information, we encourage you to seek care from a healthcare professional, and we are happy to see you in that way. So come and see us.
Perfect.
Thank you,
Jen.